Every death that occurs from an asbestos exposure could be prevented.
Don't be fooled. There is a connection.
Everything just ties together.
I don't know what I can do.
It's hard to describe what ADAO has been in my life. I certainly can't imagine it without ADAO.
We've come a long way, and I'm really proud of ADAO.
Keep me in your heart for a while.
Well, thank you. Yes, so I'm U.S. Public Health Service, and proud to be U.S. Public Health Service as one of my mentors, Dr. Lemon here, and Arthur Frank also was Public Health Service. I guess still potentially is, he's not sure. But it does afford an opportunity to work across many agencies and to do things in public health that you may never had an opportunity to do so. Before I start, first I want to thank Linda and ADAO for having me back. This is clearly an issue that's near and dear to my heart, as much of the last decade of my life has been devoted to trying to understand the issues that have been discussed here today. Also, in the terms of mentorship, Dr. Murray, who was here, Linda Ray Murray, was a former mentor of mine at Cook County and University of Illinois in Chicago, as was Dick Lemon at NIOSH, and I appreciate continuing to have that force in my life and the mentors in our lives that make a difference in terms of what we do and in terms of decisions we make to pursue careers in public health. And it's been most invaluable to me. I am now at NIH. I've been through a number of different agencies and have differing perspectives. At the National Institute for Environmental Health Sciences, which is really a different beast within NIH because it's actually a public health oriented NIH institute. Of the 27 institutes at NIH, it's really a group that tries to translate environmental health research to public health and to underpin not only our understanding, but hopefully the regulatory process and decision makers to doing things to protect citizens in the country. We also have the National Toxicology Program, which tests substances and is looking at invigorating a program at looking at asbestos as well, and that's encouraging. The issues that have been talked about, Linda asked me to talk about non-occupational asbestos exposures. First off, before I start in, can I get a show of hands of people that think that non-occupational asbestos exposures are important? I guess I'm done. It's really interesting. And a lot of these slides and even the pictures you'll see here are things that I was involved with, but have been covered in many respects by the others before me here today. So that's the problem being the last speaker. But also maybe gives me some latitude to think about ways of trying to put some of this together for you as we kind of go through it. 10 years ago or so, what was it, Brad, 99? November 99? How do I forward this anyway?
This one is forward right there.
That one?
Yeah.
All right. Before I get into this, so I'll start with a story. I think probably a story will be good at this time of day. So in November of '99, there was a newspaper article by Andrew Schneider in the Seattle Post-Intelligencer relating something to the effect. I was a young lad actually working for the U.S. Public Health Service Regional Health Administrator in Region 8 on a new project that we were going to work together with EPA on environmental issues and try to identify emergencies and catastrophes and try to prepare people for them and work together and be smart. And there was this, so we had started about a year before that. And we were working pretty cool. We were working with the states in Region 8, which is 6 states, Montana, North and South Dakota, Colorado, Utah. I'm probably missing one. Anyway, we started working with our states and trying to bring the environmental health people and the occupational health people and the disaster people all together and talk about some of these issues and concerns. And in November, there was this article right before Thanksgiving that came out, and it discussed this issue that there was asbestos contamination in this town and that people were getting sick, and there was a number of cases, and a lot of these people had never worked there. this issue of non-occupational disease. I'm an occupationally trained physician. I was in the same program, had the same 1-hour lecture that Linda Murray did, and thought I knew pretty much about it, and had seen patients at Cook County with asbestos disease. They were always workers, and it said, come on, this kind of magnitude of non-occupational illness, this is 1999. How could that possibly be? There is no way in the world that this could possibly be real. That this newspaper reporter is just out there, hey, sorry, Andy, if you're watching. So that this couldn't possibly be real. And so I thought it would be over relatively quickly. I kind of felt like we went up there and we started looking into this situation, and I met with Dr. Black and others in the Libby community, and we began to investigate, and much to my chagrin and the next 10 years of my life, the claims were real, and our understanding or misunderstanding of these non-occupational exposures are truly an imperative and truly a public health conundrum. Let's talk a little bit before I kind of go into some of it about some of just the main problems and why we don't understand them and why we don't recognize these very well. And we'll try to launch into some of this. First off is there's very poor data. Not that we, as Arthur mentioned and others, that we are still getting it that occupational exposures are a problem. I think we got it. I think the world really does get it for the most part, though there are still that battle at times we need to fight. But the non-occupational side of the house is not well characterized. The environmental sampling that's done under these conditions outside of a workplace is not done well. Typically, those samples are not useful for understanding the risks involved. And that in order to capture a lot of the risks involved, you actually have to understand what the exposures are when people are doing things. So that you have to disturb these things in a manner, or as Sean mentioned a few minutes ago and showed some, you have to disturb these things in a manner that, that shows the risks. And that you have all sorts of environmental problems. If you're outside, it's windy, it's rainy, it's all sorts of things. These samples are expensive, and when you're outside doing samples and you're putting it under a polarized, like an optical microscope that folks have been talking about here, well, all sorts of fibers confound that. A cat hair, wood fibers, all sorts of things are in the way, so you almost have to go to TEM, which is transmission electron microscope, which is expensive. And you have to have somebody who's willing to sit down and count it, and you got to have somebody who's willing to pay for it, which has been a very significant problem in terms of getting data that we need. So the other issue, and this was the assumption that has been around for a long, long time, is somehow these non-occupational exposures, they're low exposures. We don't got to worry about those. They're low. People don't worry about that stuff. And as I began to look into it, that wasn't the case. One thing that we discovered in Libby early on, which kind of forced our hand and forced our trek or journey to figure out some of these issues and to move some of the federal regulatory research programs forward and our federal understanding to be renewed post some administrations that had dismantled most of the asbestos programs in the government, was this finding in Libby that we were getting these, we were looking at soils, we were trying to look at all these different things, and we were getting measurements which showed very little asbestos in the bulk material. It was soil, and the lab would say, well, there's nothing here. It's maybe just level of detect, non-detect, trace, all these things, and we're trying to understand what does that mean. And then we're out there and we're doing stuff, and we're getting back these airborne measurements on people doing things, digging some of it up, putting the piles away, especially these little piles of vermiculite that were around town. And the levels were high. The airborne levels were high. Trace, high. Doesn't fit. Start talking to some of our colleagues. I call up OSHA and say, what's the deal with this? Oh yeah, we know about that. That's why we always do airborne measurements on workers. We don't look at the bulk material because it doesn't tell you what's coming up here. And I go, well, that's a real problem. This is an environmental site, and everything's telling us it's low, but the air measurements are telling us it's high. So we call this the Pigpen effect. You disturb something, you create this little microatmosphere around your head. If I put a monitor over there where Barry's sitting, probably won't show a whole heck of a lot. But in my little microatmosphere, I'm getting exposed, and my exposures could be incredibly high. We showed some of that before, and Jim Weber showed some of the stuff associated with the Libby vermiculite attic insulation, which we were just astounded by when we went up and started seeing that, and those findings about those exposures and the relevance of those exposures just really shook our world, and we started on this trek. So what do we know a little bit, and we've covered a lot of this. In the environmental world, or the non-occupational world, we certainly see mesotheliomas. Lung cancers, probably there. You can't cull them out because of the other exposures in our environment, especially smoking. Questions like other cancers like GI and stuff, again, not able to discern that in the environmental sector. We can do it in the occupational world. Interstitial fibrosis, interesting. I mean, there's been reports in studies of showing interstitial fibrosis or asbestosis in individuals not exposed at a workplace. Those are typically the traditional book reading on that is it doesn't happen unless you have these humongous exposures. Well, we don't have good information about what people are exposed to in their homes when a family member works, but we certainly see it. There was a case in Libby, one that actually just blew me away when we started the site, and one that just caught my attention immediately. There was a woman whose husband worked at the mine, and she died of interstitial asbestosis. Her only exposures was a domestic exposure in her home. That he would somehow come home with enough material on his clothing each day that would cause her to have interstitial asbestosis to the point of fatality. I mean, and there's other case reports of it now, and if you look at the literature. But it was just absolutely amazing. How much can somebody bring home? They come home looking like the Pillsbury Doughboy or something. You're covered with, and then you would shake it out. So what's going on? Is this material then staying in the home and re-aerosolizing, and you keep getting exposed, and your kids keep getting exposed? Is that what's happening? Pleural fibrosis, the pleural disease, clearly shown. Let's talk a little bit about it. The other thing, the numerous cases have been reported. So of mesothelioma, Mrs. Gunlock talked about her domestic exposures. Irving Selikoff had recorded numerous cases of people that had this domestic exposure and having mesotheliomas. Folks around the Wittenau mine also had very elevated levels of mesothelioma. One thing about the Wittenau mine is they actually quantitated some of the exposures. They spent a lot of time actually putting monitors on people and going around. And one thing they showed is that, hey, there was a lot of people that didn't live there very long. They came in, they lived around that mine for maybe months, less than a year, and they quantitated really low exposures. They estimated that 0.015 total cumulative exposure in their life. And this won't mean a whole lot to folks here is saying it out like that, but that's an exposure that you could reach in 2 months at the current occupational exposure level, was resulting in a doubling of their mesothelioma rate. The Marysville, Ohio is actually a really important site in terms of our understanding of some of this. This site is where Libby was sending its material. So a lot of the vermiculite went to a site in Ohio, in Marysville, Ohio. And this site was processing vermiculite to use for fertilizer, our fertilizer, OM Scott. And so Scott would attach nitrogen and phosphorus to the fertilizer, the vermiculite, and sell bags of fertilizer. And they noticed that workers were getting sick there. And Dr. Lockey, in those days was, I think, a resident, had started on a project to look at these workers that were having pleural disease, and actually that was the site that was the first identified that started the government looking at Libby back in the late 1970s. So Libby was looked at way before we started in '99 because of the worker issues. There was also a slew of concern because of Marysville and Libby happening, that the government would go forward, from the early 70s and early 70s into early 80s and look at all these sites around the country. People have been showing pictures of processing and all that. Well, the government had that on their agenda. There's good documentation that we were going to look at that, and that fell off the table in the early 1980s for some reason. Anyways, the Marysville site continues to be followed by Dr. Lockie, and he's showing very low levels of in individuals. They measure the exposures here. They have industrial hygiene, and they have found that these individuals have pleural disease at very, very low levels of exposure, levels that would be exposures that would be lower than we might associate with cancer. Very compelling. So we have many different sources that we've been talking about today, and maybe I'll just try to categorize these in a way for you. So we have our domestic exposures, what people bring home, to their house, that stays in their house. Your ordinary vacuum cleaner does not take it out of your house. You need a special vacuum cleaner called a HEPA vacuum cleaner to remove it. So it lingers there for years and years, and work done actually by, I think, folks at Mount Sinai had showed, decades even after workers had been in these homes that they could go and find asbestos fibers in these homes as well. Industrial pollution in mining areas, as been mentioned today, asbestos-containing materials and products, and disturbance of contaminated soils. Worker take-home exposure has been discussed, and again, so mesothelioma is one that was really picked up about it, workers, family members, etc. The other thing about it, besides the cancers, is the fibrotic disease. There were some nice studies done by Henry Anderson and some others looking at household contacts of folks that had been workers. And they said, let's do some x-rays on these guys and see if they got disease. So in one household study, they just found that 35% of them had abnormal x-rays, the people that lived in that house. So you're getting the scarring around your lungs. And in some, even more amazing, is that the length of employment for some of these workers, 10% were less than a month. The worker hardly was there. How much could he bring home in a month that was in your house now that's causing disease in your family? And how about this? That really kind of goes back to what my point was before, residence after work period. So these were people that actually, the worker wasn't working there anymore. He had worked there, but now people that were either born into the house or came into the house subsequently had disease that could be picked up as well in x-rays. There's also studies of shipyard workers by Kay Kilburn as well. Living near mines and quarries, I won't belabor this too much, other than the fact that the fact with Whitnum and others is that mesos were short as a 2-month exposure, a cumulative exposure. And that would be, so the cumulative exposure ends up to being 0.53. Well, certainly that's our EPA IRIS risk. There's two kinds of modalities, and Celeste kind of talked about some of this earlier, of regulations. And what the United States uses is our benchmarks. So there's our workplace regulations, OSHA's regulations, and if folks were listening before, they're not really very protective. They're still not protective. OSHA knows they're not protective. They say it's not protective. It's feasibility issues, other kinds of issues as well. EPA has a different regulation for the community, which equates to this 1 in 10,000 risk of excess disease. So it means you can be exposed to as low or a lifetime of 0.28 fibromil years. And you can achieve that pretty quickly. So in Libby, Montana, where the exposures, and Sean showed some of this before, the exposures to mowing lawns, playing in dirt, and raking, which we did. We actually went around Libby and said, what are the exposures when we do stuff that people do here? And so you saw guys in Tyvek suits. And it would be humorous that we have guys in Tyvek suits doing all this if it wasn't so damn sad that we have to do that, and the findings that we find are terrible in sense of the risks that are potentially there for the individuals in these communities. The fact that we're finding folks that can have exposures from mowing their lawn, kids playing in dirt or raking, up to or exceeding the OSHA Pell. You can exceed which doesn't apply, okay? Does not apply here because this is a community. We don't use worker regulations in the community. We don't have a benchmark. What do we apply? We apply the EPA benchmark. Well, the EPA benchmark, you can do this for 8 hours a day for 4 months, mowing lawns as a kid might do for a summer job, and exceed 1 in 10,000 risk. Other places, very Northwest Cape, South Africa, mesos, crucidolite. We've seen this all over the world. As Arthur, I think, mentioned, or somebody mentioned before about a pandemic. Maybe it was Dr. Murray. A pandemic. It's worldwide. Industrial pollution. Barry talked about Casale, Monferrato. I don't know if I do justice to that. Anyways, elevated mesotheliomas. Mansville, New Jersey was another asbestos plant. Studies of non-occupational mesothelioma in different countries have all showed around these industrial polluted sites, we continue to see excess disease. We just don't have good data about it. Everybody loves this picture. I'll give you a little story about the picture behind it, because this was one of my situations. So we started on Libby, and we started pulling all the literature. Right away. We got out there, and Brad told me some stories, and other people were telling me stories, and we go, wait a minute, this newspaper reporter may be right. And is there our next speaker, Linda, or can you indulge me for about 3 more minutes? Okay, thanks. Thank you. I'll try to go quickly. So there's 4. So the site was, we were looking at the literature, and of course the literature we found, the occupational articles quickly. One article that was pulled up was about somebody that had worked with vermiculite who died of lung cancer, and by the way, they found this tremolite in his lungs, because it was a report about tremolites. It was done by Victor Rogli, and he was a pathologist, and they were looking for tremolite and non-occupational exposures, or something along those lines, and he turned up that these kids had played in piles of vermiculite. And one of these kids, well, no longer a kid, that was the story, but the person had died at age 42 of lung cancer and had asbestosis in his lungs. And that is these individuals. This is the family, and this is across their house in Minneapolis, Minnesota, where they lived, and these kids used to play in this pile. And these sites are all over the place, but they had the same type of situation where these piles and these materials were used in driveways, yards, gardens, roads, all over the place. And these materials and these exposures are quite high. So in Minneapolis, yeah, ongoing situation. I'm going to try to go quickly, but these are the sites all over the country. EPA continues to try to look at these sites and continue to try to evaluate them. Some better than others. The true understanding about the risks is in what we were showing you today about getting out there and doing exposures and understanding what people are truly doing in those areas and getting the right exposures. We talk about products. We won't spend any time on that. The Libby site, and everybody sees Danny Kaye, and this was during the days of Zonalite before W.R. Grace owned it. But the problem exists. It's in well over 10 million, 30 million. We don't know how many homes because they never kept record. The stuff is in millions of homes throughout the country and is still a legacy of hazard. And if you go to the government website, you can find out about it, and the American public doesn't read the government websites. We're not doing a very good job in turning on the community and the workers who go into attics and do lines and cables, etc., throughout the country about these issues. I'm blowing through my time. I won't go through the exposures in the attics. This was a gentleman who lived in a house in Colorado who had peritoneal mesothelioma. His only exposure was putting in attic insulation with his father when he was about 16 years of age. This is the house. We went back to his house where he still had the vermiculite in his attic, and the exposures were just as we saw in the other presentations, above the STEL, above the OSHA REL, and this is a case that actually shows it. I'm down to 30 seconds. All right, I'm not going to go through this. Everybody loves these pictures, the sliding in the home. I like that. This one's particularly fetching. We'll move forward. These are kids that were playing in these sites, and these are the exposures. They're way ahead. Another last thing I'm just going to mention is the up-and-coming threats in the country. Stuff that's not regulated as asbestos is erionite, a very toxic mineral that we're now seeing in North Dakota that was used on roads unbeknownst to them. And the issues in North Dakota is that the erionite there is very similar to the erionite in Turkey that is responsible for the highest mesothelioma rates in the world. And with that, I will, I have one last thing, really important, before I leave. Brad, can you just get up for a second? Because I'm going to ask you to do something. Just, can you? Happy birthday, Brad. good friend Brad there. All right. You don't want me singing, but we'll all sing together. Happy birthday, Brad. Happy birthday to you. Happy birthday to you. Happy birthday, dear Brad. Happy birthday to you. Well deserved, Brad, and thank you for all your years of hard work.
But thanks for coming, and thanks for making this the most successful conference thus far.
Keep me in your heart